So I'm gonna do our standard Botox that we do between the eyes. So give me a nice frown. We're gonna soften this line here, good. Okay, relax again. And we're gonna actually soften it so she gets a little lift on her outside of her brow. Keep your eyes closed. Okay, one little baby pinch here, pinch. Use a tiny little needle. This is a 32 gauge needle. It's actually a insulin needle, pinch. So it's very small. And I don't think it feels like much of anything at all, pinch. This is to the frown line muscles here. I'm gonna put it in here, back here, so we get the tail of that same muscle a little bit. And over here. And then I'm gonna do, then what I do is I'm actually gonna put 2 right here because I'll soften the line here and I'll actually give her a little outside brow lift. So 2 little baby ones right here in the center. So you have little mosquito bites that go away in literally 5 minutes. These little bumps will go away then, and you actually won't even know that the Botox is working. It'll take about a week for it to fully work. You'll see it over the next few days. But that's it. All done. Not too bad, right?